So in a general sense, muscles that are on the front are going to be more flexors of the shoulder, and internal rotators. Muscles on the back, in a general sense, are going to be extenders and external rotators, except for the latissimus dorsi and the teres major. Okay, because they come around and they insert more onto the front, so they're going to be internal rotators. So we'll get into more of the details of them, but just in a general sense, muscles on the front are usually flexors and internal rotators. Muscles in the back are generally going to be extenders and external rotators, except the latissimus and the teres major, because it comes around to the front. It comes all the way into the intertrabecular groove, so it's going to do internal rotation. But latissimus is one of the prime extensor muscles. And then now we talk about the rotator cuff. The primary function of the rotator cuff is to stabilize and hold in the humerus into the glenoid fossa. Okay. Again, the glenoid fossa and the glenohumeral joint is the most mobile joint of the body. The two big ball and socket joints are going to be the shoulder and the hip. Okay, the hip's a lot more stable and it's not as mobile of a joint because it has a deeper socket. The hip's more like this, whereas the glenoid fossa is more like this. Okay? The thing that gives the glenohumeral joint stability is the rotator cuff. There's not a lot of ligaments that actually hold the joint together like you have in your ankle, your knee, things like that. In this case, the shoulder stability is going to be maintained more by the rotator cuff. And so what it does is it fits on it like a cup and it holds it in tight to the glenoid fossa. Okay. It's going to have some accessory functions like the front part is going to internally rotate. And what muscle would that be? Below the scapula, subscapularis, and then infraspinatus and teres minor. Subscapularis would be abduction like that. But again, those aren't the primary motions. The primary ones are to hold that humerus in tight to the shoulder joint. And so then this goes through the general, and then the coracobrachialis and the teres major are synergist muscles. Coracobrachialis is going to do a little bit of shoulder flexion like this. Teres major is going to do a little bit of internal rotation. So then the general principles, like I said before, is anterior muscles of the shoulder are usually going to be shoulder flexion, which is also called anterior elevation or forward elevation. And then they're going to mostly do internal rotation. And muscles on the back of the shoulder, what's the main motions that they're going to do? Extension, external rotation, except for two of them, which is going to be the latissimus and the teres minor. So there's basically some more pictures of the same muscles we've been talking about. And we'll get a little bit into the triceps and the biceps. Okay, so here, what's this one here? Below the spine of the scapula, so it's infraspinatus. And then this one here, teres minor, it's part of the rotator cuff. Now here's teres major, and you can see that it's going underneath the trapezius and it's coming around more to the front side of the humerus. So that's why it's going to be an internal rotator. And then the latissimus is doing the same thing. They pretty much go head right for the same spot. Then here's some more muscles crossing the shoulder, the subscapularis, and then here's the coracobrachialis. The coracobrachialis, like I say, is not really a prime mover. It's more of a synergist type of muscle. It's going to do a little bit of shoulder flexion. right, so then these are basically charts out of the book. And you've got all the different origin insertions in the notes here. Okay. We'll go into a little bit more of these details of the origin insertion when we do palpation. Okay. So just keep in mind that you need to go over these and make sure you know the origin insertions of all the muscles. Everybody making their flashcards? Right. What's that? Yeah, but at least with this, it's, you know, some of the times if you think of the name of the muscle, like levator scapula, okay, you know that's going to elevate the scapula, so it's going to be somewhere up in here, and just trying to correlate, memorizing something to tie in the name with the action of the muscle. So the pec minor is attaching to the coracoid process. And actually that's the insertion, because usually what it does is it moves the scapula like this. Usually the origin, the insertion of the muscle is moved towards the origin. So the origin is going to be on the anterior surface of the first of the ribs 3 to 5. Insertion is the coracoid process. So it's going to pull the shoulder forward and down. And then the serratus anterior, since it's attached on this front, on this medial border, but it's on the other side, it's going to be pulling it forward. Okay? That's the muscle that you see with the different slips right here. Okay? So again, so what kind of movement is that going to do with the scapula? It's going to be protracting it. And since on the scapula you've got the infraspinatus muscle here covering this back surface of the scapula, the front surface is covered with the subscapularis, and the only place left for the serratus anterior to attach to is just right on this medial border. So it's just attaching right to the edge of the rib. Okay, when you're doing stuff, we'll get into with palpation, when you're digging your hands underneath there to move the scapula out, you're actually on the front surface of the serratus anterior, but you're also moving through the trapezius and the rhombus. And then you have the subclavius, which is basically a little muscle here under the scapula. Doesn't really come up that much. Yeah. That's the scapula? Yeah. And that's the subclavius. So kind of what it does is it sort of pulls the scapula down, so it's kind of depressing the pelvic girdle a little bit. And then you have the trapezius, the regular four-sided figure. So you have the upper, so it's four-sided. What you're doing is counting this top part where it goes across the occiput as one border here. So it's like that. So you have here up at the occiput, and then it's going along the lateral part of the clavicle, and then chromium. So the upper part of the origins on the occiput, the nuchal ligament, and then the spinous process of C1 to C7. And then with that part acting by itself, it's going more to the lateral part of the clavicle here. So it's elevating the scapula like this. Then the middle part is going from C7 to T3, and then it's going here to the spine of the scapula, and then it's pulling back like that.